Hello and welcome to our webcast for March 15, 2019.
Beware the Ides of March.
Yep. My name is Christian Lebré and this is Amy Albrook, the director of Toujours Vivant, Not Dead Yet.
Hello.
Toujours Vivant, Not Dead Yet is a non-religious organization by and for people with disabilities and our allies.
Yep.
Our goal is to inform, unify, and give voice to the disability rights opposition to assisted suicide, euthanasia, and other ending of life practices that discriminates against people with disabilities. Today's topic, International Women's Day, Disability and Femicide, Part 2. So, Amy will help us through this subject.
Yes, and Christian is very sleepy, so if he falls asleep, it's okay.
It's not my fault.
Yeah, it's not his fault. You didn't sleep much last night, did you?
Just my average night.
Okay. All right. International Women's Day, Disability and Femicide, Part 2. On March 8th, we talked about how disabled women are more likely than disabled men or non-disabled women to experience the most serious forms of domestic violence, including murder. This week, we're continuing our discussion on femicide with the factors that make disabled women more vulnerable to assisted suicide and euthanasia. Okay, so in her 1996 paper, Gender, Feminism, and Death, Physician-Assisted Suicide and Euthanasia, Professor Susan Wolf states that gender affects the number, reasons, approval of, and public debate over assisted suicide and euthanasia. And that's sort of the structure of our talk. So more women than men may die by assisted suicide and euthanasia. So during the 1990s, between 68% and 72% of people who died at the hands of Jack Kevorkian were women, according to Katrina George. And there were various studies done at different times during his body count, which mounted over the years. And it all averaged out to about 70% were women. And also, most of the people were not at the end of life. A lot of them had chronic illness or just disabilities. So, and please note that I do not say Dr. Kevorkian because he had his medical license pulled. So he was not a doctor, and people don't remember that, but everybody says Dr. Kevorkian.
No.
Oh, he was not a doctor. Okay.
Killer Kevorkian.
Killer Kevorkian, yeah. A study of suicides in Switzerland found that the rate of unassisted suicides was higher in men than women by 71% to 29%. But the number of...
Almost 3 times.
Yeah, right. But the number of assisted suicides was slightly higher among women than men. So it was 57% to 43% who had assisted suicide. This seems to support Professor George's belief that more women die where regulations governing the practice are more relaxed. And she had other things that she noted, but I didn't include them in this text. So, the method of death may also affect men's and women's choices. Katrina George found that while equal numbers of men and women opt for euthanasia, which requires participation by the person who will die, requires no participation by the person who will die, more men elect assisted suicide, where the person must take action to cause their own death. And in Canada, as we know, all but only 5 people have chosen euthanasia, and that's men and women, and it equals out in the proportions in Canada between men and women. So we still haven't quite nailed down what that's all about. As well, proposals to allow euthanasia for mental illness alone appear to have a greater impact on women. Instead of a suicide attempt, which is prevented and recognized as a cry for help, assisted suicide and euthanasia ensures that such attempts are always completed.
Yeah.
So
it guarantees you are dead.
Yeah, yeah. So a study of euthanasia for psychiatric reasons in the Netherlands found that 70%, or 70% again, or 46 out of 66 of those who were killed were women. So again, it's falling heavier on women, and they want to expand eligibility to people whose sole reason is psychiatric. Sounds like a recipe for disaster to me. Okay, women choose assisted suicide and euthanasia for different reasons than men. So first, women face unique economic pressures not shared by men. They tend to work in lower paying fields, such as the service industry and childcare. Also, even when women work in the same jobs as men, they are often paid less. And that has been true forever. And unfortunately, it remains true. Okay, then. Women's career paths may be interrupted by taking time off to have children or electing to work part-time, thus limiting their earning potential. And that's important, especially in the United States, where the amount that you can receive in Social Security retirement benefits is based on the total, on the highest wage you earned during your working life. So if you're a woman, chances are your highest wage is never going to be as high as a man's.
Yeah.
Funny how that works. When women are single parents, their household expenses are usually higher than single men who don't have full-time custody of children. And even though, yes, we have child support, a lot of men don't pay child support, and sometimes the child support payments are not adequate to actually support the child. And finally, a new report from Disabled Women's Network of Canada shows that women with disabilities working full-time earn about $2,250 less per year than women without disabilities.
So they are even lower than women.
Yes.
Who are lower than men.
Yeah, exactly. So women, another thing that's unique to women is that they live longer than men and face health and economic consequences because of it. Katrina George says living longer exposes women to illness and disability, the need for help with personal care, which may only be available in a nursing home, and the death of a spouse or partner who would be the second contributor to the income of the household and probably earns more money than the woman, even with retirement benefits. And while Professor George emphasizes that elderly women do not have higher suicide rates, Sylvia Canedo points out that an equal number of women choose assisted suicide as men. Canedo says this may be behind the overrepresentation of middle-aged white women in the pro-euthanasia movement. She has a whole paper on it, and we'll mention that again before we go.
Yeah.
Women, especially disabled women, have greater health needs and receive more but less effective health care. So women are greater users of the healthcare system, but the service they get, not so good. In Katrina George's article, she cites studies that find women receive fewer cardiac treatments and procedures than men and have worse outcomes. Also, she found that women are more likely than men to receive inadequate pain management. This finding is, yeah, which, and you know, a lot of people talk about pain as the reason they want assisted suicide. So if women aren't getting their pain managed well, that's a key factor.
Yeah.
This finding is echoed in a 2008 commentary in the American Medical Association's Journal of Ethics, which notes that doctors frequently attribute women's pain to a psychological condition. In other words, it's all in your head, darling. Yeah.
Yeah.
According to the Dawn report, illnesses that mostly affect women, such as fibromyalgia, chronic fatigue syndrome, and multiple chemical sensitivities, remain less understood than those associated with men, like spinal cord injury. In other words, you can get tons and tons of research money for spinal cord injury, but the illnesses that affect women, not so much. And Taylor is not with us today. She had to go to a conference, but she did offer a commentary. And she said, even when disabilities and illnesses are noticed, the typical image of a disabled person in the minds of many health professionals seems to be a middle or upper class white wheelchair using man. So, yeah. Also, a 2013 study by the Disabled Women's Network of Canada cites a Canadian national survey stating that adults with disabilities reported more than 3 times as many unmet health needs as their non-disabled population. So disabled people weren't getting, like we said earlier, they weren't getting their needs met. They may be using the services, but they're not getting their needs met. Dawn also noted that women with intellectual disabilities are at greater risk for leukemia, uterine and colorectal cancer. And that, I have no idea why that is, but they found the correlation, so there you go.
Okay.
The Dawn report found that people with disabilities, quote, experienced delayed detection and diagnosis and complicated treatment experiences that related to cancer care providers having limited knowledge of cancer and its interplay with specific pre-existing conditions. So if you have a disability and then you get cancer,
That's your disability, always.
right? You know, it's the doctors are not going to understand how your cancer interacts with your disabling condition, because really hospitals are like factories and all the widgets are supposed to come in the same and go out the same. And if you don't come in the same, you screw up the system.
Yeah.
And I ran into...
They are always wanting to cure you, okay? But handicap, it's not able to be cured,
right.
Okay? So it doesn't fit.
Right, exactly. Yeah, you're screwing up the system. And I saw a post in Facebook today from a colleague of mine who is having a really hard time. She's an African-American woman and she has disabilities, and the medical professionals are treating her really badly. They're not believing her difficulties. They're not taking her seriously, and she's not getting good treatment. And Taylor commented, these medical staff must think that all disabled people have to deal with is their original condition. No social factors or additional illnesses ever come along and make things complicated. No, that never happens. We don't have multiple disabilities. And that's really particularly true in Quebec, where you have to, your disability has to, if there's no group that serves your particular disability, you're screwed.
Yeah.
And if you have one disability, but another disability is causing a particular problem, but that other disability doesn't have a group that serves it, you can't get help from the first disability group.
Yeah.
It's really difficult.
They always said, go to the other group. And
right.
The other ones say, go to the other group. And
right.
Nothing happened.
Right. The concept of cross disability has not really made it here. Disabled women face other barriers to healthcare, such as a lack of information in simple language and accessible formats. We try to use simple language. We don't always succeed, but we try. A lack of support and assistance at the screening facility. So if a woman comes in, she doesn't know what she knows she has a cancer screening, but she doesn't really know what the procedure is. There may not be somebody to help her understand what's going to happen and help deal with accessibility problems. Also, negative childhood experiences with medical professionals, including being forced to strip and being examined by large groups of clinicians. And I know a lot of people with orthopedic disabilities have had that experience, where you're sort of paraded up and down in front of a whole auditorium full of doctors in your underpants. Yuck. Also, physical barriers like inaccessible examination tables and diagnostic equipment.
Yeah. You can go to with a wheelchair in an examination room.
Really? See, stand up for the monitor. Oh, yeah.
Oh, yeah.
Oh, right. So can't have a mammogram. So much for early detection. Okay. Lack of knowledge about reproductive health due to overprotective family members, because what? Disabled people don't have sex.
No. Don't think about it.
Right. Focusing on cures and normalization rather than comfort, health, and wellness. So parents and doctors who force people to walk, even though walking is painful, difficult, slow, and not very productive. but it's walking. Even though using a wheelchair would be easier and faster and more effective. Inadequate attendance services, lack of insurance coverage or funding for necessary medications, equipment, or procedures.
No, insurance companies are not like
They don't
that.
turn people down. Carrie and Lucas. Inflexible or unreliable transportation. Yeah, so if the transportation is limited and medical appointments are prioritized, but if you can't get transportation, I heard from another colleague this morning. She said she spent 3 hours trying to get arranged trips for just one day.
Yeah, and she will be lucky because it's a trip. If it's medical, she might have. If it's something related to work, she sometimes have.
Right.
And if it's a traveling
if it's
for any other
reason, forget it.
Yes, basically what it is.
Yeah. Okay. Professor Wolf believes that women sometimes choose assisted suicide as an escape from dangerous or oppressive situations. This can happen when a woman feels trapped in an abusive relationship or when she sees no way out of an inhumane institutional care. And we see that, twice a week in the newspaper. Yeah. There's a story about poor quality care. And for some reason, it always comes down to, it's their disability is the problem. No. Problem. Disability is not the problem. The problem is the system that prioritizes custodial care rather than care in people's houses. Some of the reasons women asked for assisted suicide and euthanasia are based on gender stereotypes. Professor Wolf relates women's assisted suicides to the long history of cultural images revering women's sacrifice and self-sacrifice. And Katrina George notes that good women are supposed to sacrifice their own interests in favor of the needs of others. So, and you oftentimes in the reporting on people who are asking for assisted suicide, they say, I don't want to be a burden on my family. And, everybody's like, yes, we understand. So you should die. Huh? No. Doctors are more likely to approve requests for euthanasia from women. That's the third point that Professor Wolf made. And she believes that physicians are likely to approve assisted suicide for a woman if they believe that her life has become meaningless and a burden because she can no longer care for others, i.e., she's no longer fulfilling her destiny as a woman. Yeah. And Taylor commented, So our society is so stuck in the past that thinking that women have no value unless they're serving others. Is that really the case? And unfortunately, I think it is. I think it is. Okay. So Professor George cites a study of 252 Australian doctors, which found that given the doctor's perception of the patient's emotional distress and hopelessness, combined with the doctor's limited psychological training and his or her own difficulty in caring for the patient, the doctor may be more inclined to hasten the death of the patient. And we saw, I posted something on Facebook today, another example of that. It was a psychologist, a woman had pain and she was saying, I'm in a lot of pain, I'm thinking about assisted suicide. And the psychologist says, sounds like a great idea.
Yeah.
Not doing his job. Gender affects the public debate on euthanasia. Professor Wolf stated that much of the early debate centered on the cases of women, including those killed by Jack Kevorkian. She also notes that the images in those cases have long cultural lineage, a long history of portrayals of women as victims of sacrifice and self-sacrifice. She adds that even while we rationally debate questions of autonomy and interdependence, self-determination and discrimination, we may be driven by images of women's self-sacrifice that give assisted suicide and euthanasia a certain gendered logic, and it feels correct. It feels right. And that's what she wants people to examine, to look at. And Taylor said, in other words, assisted suicide is approved based on a collective hunch, to borrow a phrase, or a sense. Is that what we're saying? And unfortunately, I'm afraid it is. So the effects of combined discrimination in a new article from Colorado State University professor Sylvia Caneto discusses the lack of support for assisted suicide and euthanasia among African American people. As Caneto notes, because women of color have less access to financial resources and face greater discrimination in the healthcare system, they are less likely to place their trust in a process that is overseen by doctors, insurance companies, and publicly funded medical providers, which makes a lot of sense. And so in some ways, the fact that they experience worse discrimination makes them safer, but unfortunately, the rest of the population is not learning from their experience. So, in her presentation to the Federal Joint Committee on Physician-Assisted Dying, former Dawn President Carmela Hutchison told the story of Misty Franklin, who became disabled as a result of domestic abuse and ultimately chose to end her life because she lacked the supports she needed to control where and how she lived. She explained that Carmela explained that the life and death of Misty Franklin reflect the link between sexism and disability discrimination. So to start, Ms. Franklin grew up in a violent home. She met Trevor Fontaine, who had an extensive criminal history of sexual assault and violence against women, in September of 2003 when she was 24 years old. 3 months later, he stabbed her in the neck with a pair of scissors during an argument. When she woke from the coma, Misty was quadriplegic and needed to use a ventilator. A lack of resources, including home care, good pain management, and mental health services, meant that Misty spent most of her time isolated and in pain. The few support she could obtain required her to live far away from her daughters, her family, and her friends.
So isolation.
Yeah.
Completely.
And people talk about that a lot as a factor in you know, making them want assisted suicide and euthanasia.
It's a very heavy factor.
Yeah. Ms. Franklin set a date in the fall of 2013 for her to have her ventilator removed. As the date approached, however, she realized that time was going by too quickly and there were still things she wanted to do, which is, again, people are usually ambivalent about this sort of thing. And so she postponed her death, but she eventually followed through with her plan and died in January of 2014.
Okay, refusing treatment is
All right.
a right, so she used this right, and we doesn't have anything to say about this kind of death.
Right. It doesn't make us happy.
No, no, that is never a happy thing.
Right.
But she just used her right.
Yeah, and unfortunately, that you know, disabled people tried to defend against that policy that allows disabled people to die like that, but it was a lost battle, and so we needed to step back and sort of try the next battle, which is against assisted suicide.
Yeah.
So it is a right to refuse treatment, which she did, and she died because of it. All right, last word. We were excited to see the new article by Sylvia Canetto, and because it reinforced a lot of points that we wanted to make. It was a shame then, if not a shock, to discover that the disability rights opposition to assisted suicide and euthanasia was completely absent from the text and her ideas.
Yeah,
it was like
doesn't exist.
It was like we were erased. It just goes to show that when the subject is the intersection between two or more kinds of discrimination, chances are somebody is going to lose out.
Yeah, and sometimes it sucks.
Great. And actually, I had to apologize during the French webcast because I was not able to find articles in French that talked a lot about most of the subjects that we discussed today, because I couldn't find them, and that was my fault. But also, there isn't much out there written in French on these subjects, and that's a shame. That really is a shame. So,
yeah.
Okay, so if you want more information about the subjects we discuss here, you can visit our Facebook page at facebook.com/toujours vivant, not dead yet, all one word. You can visit our website at tvndy.ca. You can email us at info@signtv-ndy.ca, or you can follow us on Twitter @signtvndy. Thanks to Christian for helping out.
Thank you, Amy.
And thanks to you for being there.
Take care.
We'll see you next